Hi, Alexander Armugan. Just gonna do my hand wash. Gonna look at my patient's notes and identify my patient. Mr. Kane Dobson, his medication chart, his OBS chart. We'll proceed to introduce myself to the patient. Hello, Mr. Dobson. My name is Alexander. I'm the nurse that's going to be looking after you. How are you today?
I'm okay, just in a bit of pain.
Bit of pain? Okay. How would you rate your pain out of 10? With 1 being not much pain and 10 being really bad.
About a 6.
About a 6 out of 10, okay. And whereabouts would you say your pain is coming from?
My rib area as well as my right leg.
Okay.
A lot of pain there.
Right. And is there anything that makes the pain worse?
I found breathing and any movement in general really makes the pain a lot more, hurt more.
Okay. All right. Well, I can see here that you have morphine ordered for your pain relief. So I'm just going to make sure I've got the right patient and identify you correctly.
Okay.
So can you please tell me your full name and your date of birth?
Okay, so my name is Kane Dobson.
Yep.
And my date of birth is the 31st of the 3rd, 1994.
Very good. And your MRN is 0956742. Are you allergic to anything, Mr. Dobson?
Yes, penicillin.
You're allergic to penicillin. And what will happen if you have penicillin? Do you know?
My face swells.
Okay, well, we'll definitely not give you any of that. So I've checked your observation chart, and all your vital signs are between the flags. They're all stable. So I'm happy to give you the morphine, okay?
Okay.
Okay, I'll be right back. I'm just gonna get your morphine with another nurse, okay?
All right, thank you.
Awesome, I'll be back very soon.
Bye.
Second hand wash after leaving the patient's bedside, where I will now go to get the morphine with another RN.
Cool.
Do my hand wash. So now I'm going to validate the medication order. So I've identified the patient as Kane Dobson, MRN 0956742, date of birth 31st of the 3rd, 1994, allergic to penicillin. If he hasn't, his face will swell up. It's been dated. He has the medication, 15 milligrams, the dosage. He's having it orally, 6 hourly. The indication is for analgesia. It's been signed by the doctor, and it hasn't been given yet.
Yep.
So now thank you. Second eye. I'll just double check it in the MIMS.
Yep.
So here we have the medication, morphine. It's an analgesic for pain relief. The normal dose for adult is 5 to 20 milligrams to be given every 4 hours. Contradictions include biliary tract surgery, respiratory depression, cyanosis, and excessive bronchial secretion. Adverse effects include respiratory depression, circulatory depression, respiratory arrest, shock, and cardiac arrest. So we will definitely be looking out for those signs after administering the morphine. And so yeah, just look out for the signs after administering the morphine. Now I'm going to get the drug book. Now I'm going to get the medication out of the drug cupboard. Yeah. Here we have the morphine. Okay. Now I'm going to do my first drug check. So here I have, so this is the patient, Kane Dobson, date of birth 31st of the 3rd, 1994, MRN 0956742. He's allergic to penicillin. It's per the medication chart, it's been dated. He's having morphine. He's having 15 milligrams, 6 hourly. He's having it orally. It's for analgesia. It hasn't been given yet. It's the medication, 5 milligrams for every meal, and it's not expired yet.
Beautiful.
Happy with that?
Yep,
Perfect.
happy.
Alright, so what I'll do now is just do my drug calculation.
Yep.
Because it is for checking. We were checking, can you check your
So I've done my calculation. We'll be giving him 3 millimeters of morphine.
Yeah.
So now I'll proceed to my second drug check. So I've identified the patient, Kane Dobson, 31st of the 3rd, 1994, MRN 0956742, allergic to penicillin, will cause face swelling. So this is the medication morphine. It's been dated, hasn't been given yet. There's the medication, he's having it orally. The required dose is 15 milligrams, and we've calculated that equates to 3 milliliters.
Yep.
He's saying it's 6 hourly. It's for analgesia, pain relief purposes. Signed by the doctor, print name, hasn't been given yet. This is the medication, and it's not expired.
Awesome.
Awesome, thank you. Now I'll proceed to draw up the medication.
Yep.
And wash.
Everything. All my hormones are okay, except thyroid. Because she has started the thyroxine. And last month I automatically stopped this. And if I stop this, that's why my thyroid level is again increasing. It's fluctuating. Sometimes high, sometimes high, low, high, low. So that's what last time when I met her in February, she said that even I said to her that now we are planning for baby. So then she said as you are planning for baby and your thyroid is fluctuating.
Okay, I'm
So
drawing
now
up
I
the
can
morphine
start
now.
medication.
Yep.
That's why it's stabilized. Yeah. Thyroxine. And I have I eat this medication for 4 months, and
Okay.
in the COVID situation,
That's
I
3 milliliters of morphine right there.
Beautiful.
And I lost my prescription, and
Okay.
in repeats, I can buy the medication again when I finish my medication. Exam time, so I don't have enough time to go to her. And I
Okay,
just stop
I will now proceed to do my third drug check
Yep.
with my RN. Okay, so this is the patient which I've identified, Kane Dobson, 31st of the 3rd, 1994, MRN 0956742,
Beautiful.
allergic to penicillin, will cause face swelling if he has it, so we're not giving him that. So this is the medication morphine, it's been dated on the med chart. So there's the medication, he's having 15 milligrams, he's having it orally, 6 hourly. The indication is for analgesic purposes and pain relief. So it's been signed and by the doctor with the print name, it hasn't been given yet. There's the medication, morphine, 5 milligrams for every ml. The medication is not expired.
Beautiful.
We've done our drug check, we're giving him 3 milliliters.
Yep.
And here is the medication drawn up.
3 mils.
3
Beautiful.
mils, perfect. Alright, so I'll just fill out the drug form.
Mm-hmm.
So today's day.
this one because it is for 3 months. After 3 months, I will give you permission. Not now. By this time, if you consent, then I can go in this process. Because you make a big mess.
So the amount we're giving is 3
That's
milliliters.
why she tell me 3 months. I will give.
So our original balance was 50, so that means we have 47 left over.
Adjust or stop this, everything, every medication. Don't you?
Right.
I
And I'll just put
made
my
you
print name,
a situation. I prepare you and you do a big mess.
and I'm going to sign it. I'm just going to get my second RN to come over and co-sign it.
You are inside, you are a healthcare worker. How come you do it? My God, half an hour, just shouting.
Thank you very much.
Welcome.
So now that that's sorted, I'll put the morphine back in the drug cupboard.
Yep.
I have headache.
And I'll proceed to put this back
Yep.
onto the drug cupboard. I have my morphine and my med chart, patient's notes, the keys, and I'll proceed to give it to my patient. Just do my hand wash, Rob, before I see the patient. Hello, Mr. Dobson. How are you feeling? Still in a bit of pain?
Yep. Still in pain.
Still in pain? Well, luckily for you, I've got your morphine right here. Just before I give that to you, I'm just going to do a final check with my nurse. Can you please tell me your full name?
Kane Dobson.
Yep, and your date of birth?
The 31st of the 3rd, 1994.
Yep, and your MRN checks out 0956742. And are you allergic to anything?
Penicillin.
Penicillin? Okay, well, we won't be giving you any of that. Alright, so I'm happy with that. I'm going to give you your morphine. Other nurse, are you happy with that?
Yep.
Yep, awesome. Okay, just going to squirt some into your mouth, okay?
Yep.
Alrighty, and I've got some water to wash that down with. Okay.
Thank you.
That's okay. So, I'll give you your buzzer. Just buzz me if you feel any negative side effects like nausea, severe dizziness, or anything that's not usual to you. But I will be back to check up on you in about 15 minutes, okay?
Okay.
Okay, nice. Thank you for your time.
No, thank you.
That's okay. I'm going to do a hand rub after leaving the patient's bedside.
Mm-hmm.
And I will now sign the med chart. And can I get the second RN just co-sign, please?
Yep.
Thank you very much.
Thank you.
That's been signed, and I will now dispense of this equipment properly.
Okay.